So we are going live. So hello again and welcome everyone to another Facebook Live. I am so excited to have Dr. Madison Kackley again here with us. We had an incredible discussion last week, and so many people were just saying they had so many more questions. So we invited her and Dr. Sainz back. Unfortunately, Dr. Sainz couldn't make it today, but we will definitely get her back here as well. So thank you so much, Madison, for being here with us again today.
Absolutely. Happy to be here.
So I'm just quickly going to start off and just give everyone a review of who you are and what it is that you do, for those that maybe is joining us today for the first time. So Dr. Madison Kackley is a distinguished research scientist, and she leads the She Is Lab, and this stands for Scientific Health Empowerment and Integrative Solutions at the Ohio State University, serving as a pioneering force in advancing women's health and wellness. Through a multifaceted approach encompassing nutrition, exercise, and rigorous research, She Is Lab is dedicated to unraveling the mysteries of optimal well-being for women. Dr. Kackley's research delves into the effects of exogenous ketones and ketogenic diets on various physiological outcomes, metabolic health, and cognitive function. Her career is marked by a profound exploration of keto-adapted phenotypes across diverse populations. And noteworthy among her recent achievements is a groundbreaking trial demonstrating the potential of specific dietary interventions in restoring menstrual cycles in overweight or obese women. This discovery has catalyzed further investigation into women's health, addressing issues such as insulin resistance, polycystic ovary syndrome, and perimenopause. So that is Dr. Kackley, Dr. Madison Kackley. I know everyone is so excited to hear more from you today. I mentioned to you now, just before we started the live, even some of my friends, they sent me messages and said, please, can you ask this? Can you ask that? So thank you so much. I quickly just want to go over here to our Facebook and see if we have who's here with us, if I can get it to open. So if this is your first time joining us, please say hi in the comments. Let us know where you are from. And if you have any questions for Dr. Kackley, you are welcome to put it in the comments section, and we will do our best to get to the questions today. We're going to dive in today with some of the questions we didn't get to last week, just to make sure that we get to all the questions today. So, Madison, if that's fine with you, I'm just going to start with one of the first questions.
Yeah, absolutely.
And it is from Gina, and she asked, as a female athlete following a keto diet, I am always told that a keto diet is dangerous for women and only applies to men, and also that a female athlete's performance will not benefit from fat as a fuel source. I perform very well on this diet and fueling strategy. Are there actual risks to my performance or hormones or metabolism, or is this a case of misunderstanding of how women respond?
Love this question. I want to start with part of the question. I perform best on this diet. Just keynote there because it's very individual. Dietary strategies and dietary interventions should be individual. And especially when it comes to women, one, you shouldn't have somebody telling you that this is only for men. For starters, I'm just going to throw that out there. That's my tagline. No, absolutely. Ketogenic diet is, it's essentially natural and I would say archaic, but it goes back to eons and eons ago. We're just now meticulating these different carbohydrates, and when it comes to industry and creating different foods and not just dietary supplementation, but just formulation of food. Like we just started all of this complex stuff now, right? We didn't have the Wonder Bread factory way back when. So no, ketogenic diet is absolutely fine. In regards to what your performance outlooks are. If you perform great here, that's absolutely awesome. So that is just on the dietary performance side. And if you have more meticulous questions about that, can absolutely answer that. But I really want to hone in on the hormones. So even though the population that I'm about to describe is not necessarily athletic or performing or what have you, I just want to give one of the key components to why we're looking so hard into this women's initiative. This is due to one of the studies that we had that was I think I had maybe mentioned this last week, but it was a weight loss study in both a ketogenic diet and a low fat diet. And it was a weight loss study for men and women both. And that was fine. We were looking at some really great markers, just checking out, we wanted them to lose weight. So it was hypocaloric by nature. So we gave them 75% of their maintenance weight. And then after we've put out probably 4 papers by that time on just that study alone. So we're looking at renal analysis, we were looking at body composition, liver fat in regards to MRI. We decided to go back and look into the forum of just some of the surveys that we were using, and specifically for women. I was working with Milani Brownlow. She's now at NIH, but she's a wonderful resource as well. We wanted to pull out the women in the study specifically. And when we did, we had a very anecdotal based survey, just the one of them that we typically use in the lab, asking, hey, in the last 2 weeks, have you seen any differences in your period? Have you seen any menstrual changes? So we asked for a change in timing, a change in frequency, a change in intensity, and a regain of the menstrual cycle. Well, there was 13 or 12 to 13 men and women in each group. So we had 3 groups, 2 ketogenic diet groups and 1 low fat diet group. So there was about 6 or 7 women in each group. Pulling those out, let's see, there would have been 13 women, I guess, in the ketogenic diet group and 6 women in the low fat diet group. And 11 women had a change in their menstrual cycle being on the ketogenic diet group. 6 of those women had a regain in their menstrual cycle. So they hadn't had it for a little while. Whether it be because of their birth control or, and this was a weight loss study, so there may have been metabolic influences that were causing them to not have a menstrual cycle, but they gained it back. So it was secondary amenorrhea essentially, as opposed to what they thought was probably postmenopause. They were still technically in the reproductive health status, like historically, this would have been an okay time for them to have a baby. So like 45 now, I guess we kind of look at it as a geriatric pregnancy or later pregnancy or something that's more high risk. But at one time it wasn't. We look back to really early in times, and there was women having babies up until, hundreds of years old. And so it's just times have changed. And essentially, women are told now, like, you have until 31 or 35 before you become a high risk because you're older in pregnancy. And we're seeing that there was that change from just the ketogenic diet was substantial. Now there was a few women that weren't necessarily the most happy with me. They thought they were done with it, but actually this was incredibly healthy. So all of that to say, no, whoever is telling you that obviously hasn't done any reading. And although a lot of the preliminary evidence in a ketogenic diet is mainly focused on general groups or special populations in terms of like ailments and illness, there needs to be a lot more done in terms of women's research, which I guess is where our lab is coming in. So ideally, because we are our own machinery and our own entity and very individual, no one should be able to tell you that that's not good for you. If it feels good, if you're regular, that's absolutely okay. We've seen some changes positively in hormone fluctuation during the cycles. So we had them on the diet for 6 weeks. So that goes through at least one cycle. Again, we kind of restarted a couple people, so that was a little bit of a different matter. But our future studies look to elongate that dietary process, so that dietary intervention, so we can actually see, so yeah, maybe we do change them. How are we going to, or how does that actually affect their cycle phases? So if it feels good, go for it. And no, that's absolutely not a man's diet.
Thank you so much for that, Madison. I have to ask, what did the study results look like comparing those 2 diets?
Yeah, so we had planned the diets to be hypocaloric. So by nature, both of them lost the same amount of weight. We also, even in our low fat diet, I had mentioned our scientist and research dietitian, Taryn Bedell, is very extremely meticulous in making sure that there's no bias in our studies. So we're not going to give them like, the worst low fat diet possible. She's very meticulous about micronutrients, macronutrients, obviously, and then minerals as well. So everybody lost the same amount of weight and had not necessarily a positive, but no change in lean body mass. So no differences between the two groups. But in regards to the menstrual cycle changing, and then there are a couple other studies that haven't exactly pulled out just the women, but we saw positive effects in mood in regards to ketones, but using also ketone supplementation. So one of the things that we see when you go into keto adaptation is that keto flu, essentially. It's just ill managed, well, anecdotally speaking, it's ill managed nutrient intake. So if you're not looking at your minerals and not watching those, that can be a problem. But we're seeing great results when we're making sure that we're adding the appropriate sodium due to the natriuretic effect of the diet. So I mean, some really cool things. Again, there's I think that we have 5 papers out on that now. We're still waiting for the female one to be printed. It's been accepted, but we're waiting for it to be printed. But that study, you can kind of put all the pieces together and find out that, even on a well-formulated ketogenic diet versus a low-fat diet, also well formulated, you're seeing a lot of really positive effects in the ketogenic diet.
That's great. Maybe I can just get the links to those studies after the chat, and then I can just share it in the comments if there's anyone that want to go have a more in-depth look at it to see exactly what to find. It sounds really, really interesting.
Absolutely. Absolutely. I'll do that.
Great. The next question I have is, I'm going to go with this one because it kind of touches on some things that you've mentioned. It's from Lorica. She's asking, apart from hormone replacement therapy, what can we do to increase estrogen after menopause? Specifically asking because of joint and muscle aches, and was told it was due to low estrogen.
Yeah, and so that's basically a 2-part question here. So we would have to look at one, the level of the low estrogen. Essentially, it would be great to have what you started at in a reproductive normalcy. So as in you are still in what they would consider reproductive healthy status, like where you can go ahead and have a baby and there wouldn't be any risk concerns or what have you. So we'd have to look at what your hormone levels were there. But then targeting what your current not just dietary intake is, but also what your exercise is like and your familial background. So there is a little bit of genetics that play into this, but it's not something that we can't mitigate. So having a regular exercise routine is incredible, especially in regards to resistance training with kind of, it's almost like like a mechanical force into normalcy, essentially. You have exercise and you fuel yourself appropriately and your body's going to get back to whatever would be normal. That's one of the reasons that we kind of fall out of, especially women. As soon as the menstrual cycle stops, we hit menopause, and then all of a sudden everything just, we gain weight, we feel more tired, our cognitive level decreases. Well, that's because, again, our bodies are so used to playing a cycle of, am I going to make a baby? Am I going to make a baby? Am I going to make a baby? Oh, we're done? Okay, well, I guess I can kick my feet up. And essentially, we don't want that. But there are things like the ketogenic diet that we've seen kick us back into what would be homeostasis, kick us back into regulation, essentially. So it's going to be very specific to how that increases estrogen, but just going back to the very basics of bringing yourself to what would be normal. So that making sure that you're exercising, your body wants to move. We don't feel like moving after we get out of that cycle, but we really, really need to, making sure that we're fueling ourselves properly. That's another issue with the hormones being there in a whole cycle for all of your life and then kind of dropping off. You don't know what foods you want and you only look for the things that you're maybe craving at that time, or you've seen a lot of, or you know that it's going to be almost immediate pleasure. Once we start looking at our food as something to fuel us, and we actually pay attention to how it makes us feel afterwards, our body kind of jumps in line too. So without jumping into other exogenous supplementations, I really believe that if you were to meticulate your diet to what would be normal and natural for us, essentially, and go back to exercise, what should be normal and natural for us, you can get at least your body into a more positive, healthy post-menopause reproductive status.
So, Madison, why is it that some women tend to gain weight after menopause? So I've heard a lot of people say, well, I haven't changed anything. I'm eating the same. I'm exercising the same, but I am just gaining weight and I'm not losing any. Why does that happen?
Yeah, and well, the actual map of why that happens, we're still working on that. But my understanding and kind of why we are creating the studies and directing the studies the way they are is because we are cyclical. Our body is so used to changing every single week for reproduction that when we're past that stage, our bodies are just like, okay, well, what do we do now? Do we have much life expectancy left? What are we doing if this was our sole purpose? If you think about even after pregnancy, so you have all these hormones during pregnancy, and then you have the baby, and they're absolutely gone. Like there is no like trickling out. We're just waiting for it to decrease. I mean, HCG, yeah, you'll probably test positive on a pregnancy test for a little while, but that's just because it takes time to get out of your system. But everything else, I mean, the hormones that go into actual labor itself are spiked heavy, and then everything drops. And that's why the postpartum depression is so heavy and so prevalent as well. And it takes time, but we eventually get back to another cycle or something along the lines of, and that's another thing that probably, not even probably, it should be very well pronounced in the medical field is understanding postpartum depression. We want to give women, antidepressants and what have you, and not looking at what the actual potential cause and concern of this is, and it's the energy intake that is now decreased and depleted and changing in the absence of all these hormones that were just there. Your body was so used to all of this happening, and even though yes, we do gear up for labor, there's more often than not women are induced into labor. There's spontaneous labor, something happens, we have C-sections and what have you, and none of that is normal essentially, so your body's not prepared for any of that. And so afterwards, and especially if you have women who have gestational diabetes or maybe some insulin sensitivity or insulin resistance concerns, that they're going to have a hard time kind of metabolizing all of those and getting everything kind of back to regulation. And so when you have I guess, the juxtaposition of having those hormones there and then those hormones gone, and then the energy needs that were there, and now they're a different type of energy need, your body wants to hyper focus on the baby essentially. And so it's going to take away the energy from your brain, which is where the mood and everything that kind of starts to decrease because we don't have that hyper focus there. So I feel like women play a very intense game of trying to figure out where our priority needs are. And most of the time it's in our reproductive system because of how we are made. And then when it's not, the roadmap that was there and the job that we continue to do for so many years every month, I guess all of our internal worker bees are like, all right, so what do we do now? But yeah, so I think that's one of the reasons. Once we kind of lose that cycle, our body it gets lost in what to do. So we've focused so heavy on reproduction that our body forgets that the metabolism part is there, that we can be an entity without having to create a baby all the time. And I think that that's why it's so hard for women postmenopause to lose weight, even if they continue the same exercise regimen.
I mean, a lot of what you're saying also now about, postpartum also resonates because often you find women that says, okay, after I've had my baby, I cannot lose weight. They struggle a lot with things like that. But what I found really interesting is how you explain kind of like after birth, there's just the hormones are gone, like the big change that happens. And so I'm a mother, but not by birth. But I have a lot of family and friends that has given birth, and I don't think this ever gets explained to them in such a way that they can understand what is happening to them, not only physically but emotionally after they've had a baby. And then that kind of turns into the whole stigma around people, like, postpartum depression, and like not wanting to talk about it and scared to reach out for help and what to do about it because it's not understood. And I don't think women are necessarily prepared properly for that change in their body.
No, not even. One of what should be done after birth, women should be given a dietitian. It should be on insurance that women are given a dietitian because there could be so much use in application of diet, just this because it's a recovery period essentially. It's like, I mean, and I'm speaking from experience and not even just trying to make this as aggressive as it is, but like you're recovering from a car accident essentially. And when you leave the hospital, unless there is something wrong with the baby or what have you, they're like, okay, we'll see you in 6 months, and maybe you can have sex after that. That's literally all they give you. And it's absurd. We need a dietitian and we need a behavioral specialist, whether that be a counselor, a psychiatrist, or what have you, and one that's not necessarily ready to push a bunch of medication. And there are some people that need medication, and that's absolutely fine. But I really think a lot of it can be mitigated with diet, essentially. Our lab works a lot in the metabolic psychiatry realm, and there are so many bouts and have nothing to do with women. I mean, women are involved too, but nothing to do with them specifically. Bipolar, depression, anxiety, all of those things can be mitigated through diet, and women aren't given any of that. In fact, just for pregnancy alone, what you are given, unless you have gestational diabetes, you are read a script of don't eat deli meat, watch your cheeses, what have you, and make sure you have enough calories and good luck. There's nothing super useful in any of that. And I guess some of it could be useful, but it's not enough. It's not what we deserve, essentially. And so coming out of pregnancy, there needs to be more postpartum care. And I think that would be most beneficial. I mean, how many women have suffered postpartum depression and have done it in silence? This is where the concern is, and this is where there needs to be so much more, specifically in regards to women and things that they can control on their own. It's one thing when we have big pharma companies, and I'm not saying anything against medication, but like, companies that are like, okay, try this medication and try this medication and try this medication. And then when it doesn't work, we're even more upset, more concerned, and it's something that we can't control. But diet is something we can control, and we can control it every single day. You can't go in and tell your doctor, hey, I want to take 5 milligrams more or 5 milligrams less. They have to go through a whole process of telling you, the woman who birthed, raises, takes care of the entire household, yourself, and a job, and does whatever. They're going to tell you what to do. No, absolutely not. But I think diet, nutrition, it's something, or nutrition and even exercise, something that we can manage ourselves, and something that there should be a course after pregnancy on how to get yourself back into normalcy.
Thank you for that. I wholeheartedly agree with what you're saying. I'm going to go on to one of our next questions, and that is from here from Oswald, and he was saying, wow, you mentioned creatine. And that was now from the conversation from last week. And he was saying, I do feel that I do better, gain more, and able to do more reps when supplementing with creatine. What are the options on that? And then I saw there was another comment from someone, so I'm just going to read it together. From Mick was saying, I've read that creatine is a lot less effective in older people, 40 plus. Interested to hear whether this is true.
Yeah, absolutely. Okay, so I know Dr. Science had talked about creatine later, and actually my mentor, Dr. Jeff Bullock, was on the creatine bandwagon, or he had emphasis on creatine before he switched over to low carb. So as in regards to if it's not as well administered or well utilized in people that are older, watch your resources. Be careful of your resources. So there is a very good, and I'll send this to you as well, but there is a great review, ISSN Creator of 2017, that talks about the current literature on creatine, and speaking from adolescents all the way to older population, honestly, everybody, there is more positive than not, more positive results than not. That supplementation is extremely useful, especially if you're not if you don't feel that you have adequate nutrition. And again, back to the first question in the sentence in there, I feel great when I use this, then absolutely use it. That's your telltale. You'll know, especially in the athletics and performance, if you don't feel great, don't use it. If you do, great. Then I would say that you're probably on the right track there. But in regards to that review, like I said, they go over quite a few studies that have actually used creatine, and there's more positive than not in all of these populations. They also mentioned their tagline at the end of this really great review is to make sure that you're paying attention to your resources. So anecdotal evidence and some of the, articles and the fab articles that you'll find online isn't great. I mean, if you're to give a comparison, go look at ketogenic diet on Google, and you're probably going to find like it will kill you. You don't want to look at that. You want to find really great resources. So PubMed, Google Scholar, essentially those. But Creator 2017 from ISSN, it's their review.
Great. And then another question, and this is actually from one of my friends, Antoinette, and she wanted to know, is there like an age limit for the use of creatine? Like at what age can you start using it? Let's say in young teenagers or children, because I mean, like you said, what we know is there's quite a few benefits, whether it's for performance, cognitive performance, and the question was, can you give it to children? What do you have any opinions or thoughts around that?
Opinions or thoughts? It honestly is dependent of the background of the kid. So puberty is hit in different children at different times, very individualized. So if you do a metabolic panel run up and you see some deficiencies, you see some micro and macronutrient deficiencies in the child, your registered dietitian may find that it's necessary to use that. I have a 17-year-old, and he has used creatine in the past, probably, he had used it at 15, I would say. And he's 6'2" now, and kids always had a great amount of muscle. So it can be done, and I was completely fine with that. So it's very dependent on how you feel, how physically active your child is. My son did football and wrestling. I think during that time he was doing football and wrestling and something else, but yeah, so it just depends. And he definitely needed some more sources of food because he was the kid that took his lunchbox to school and then came home with it basically still full. And so like getting different supplementation was really good for him. So
thank you so much for that.
Yeah.
The next question is from Shannon. I'm 16 weeks pregnant and I train and run every day, but recently I've not been able to eat protein like meat and fish. This makes me nauseous. What would you suggest as a protein replacement?
I believe that here for our studies, we use like isopure protein shakes. Those are always good. And honestly, coming from the pregnancy side, especially if it makes you sick, having that cool drink, essentially, if you put the ice in the shake and blend it, so much better. There've been times where my parent Badell and I have been pregnant in the office, and like one of us is nauseous. Somebody comes in with a smoothie or something cold, but that one's great. Isopure is very low carb, so of course I'm gonna preach the low carb one. But there are some really good protein shakes out there that would be useful if you really feel that you can't take that in.
Thank you so much for that, Madison. The next question is from Maritza. I have been craving ice, so I would eat ice like a snack. Do you perhaps have an idea why this is? Is it maybe something my body is craving?
Well, if it's ice, well, actually, there's a whole bunch of things that possibly could be. But one of the things that I would tell you, if you are craving ice specifically, even if you just like if you think you just like the texture, it may be something in your electrolytes and your minerals. I would look for an electrolyte or a mineral packet, and then water follows solute essentially. So if you don't have enough sodium, or if you don't have enough minerals essentially in your body, and your body wants more water, you may feel hydrated and you're like, I drink some water or what have you, but it's not staying in your body essentially, or it's being, expired, or you pee a lot, that kind of thing. You may look to have something in your body that holds on to that water. So maybe using some electrolytes.
That's very interesting. Before we continue with the questions, I quickly want to hop over to Facebook and just say hi to a few people who checked in with us. So Maria tuned in from Melbourne, Australia. Maritza saying, hi, Jana and Madison, so glad you are back. Wendy is tuning in from Canada, all the way from Ottawa, Ontario. So welcome everyone, and thank you so much for joining us. I'm going to go to Wendy's question next, and she's saying, I'm a 65-year-old woman on a carnivore food plan, and I'm a master swimmer, also doing home strength training. My ongoing goal is to stay healthy, fit, and to be optimally lean. Thoughts as to foods in particular, including dairy or not. I eat 2 to 3 meals a day and roughly 70% fat, 30% protein. Thanks for any thoughts and suggestions.
Oh, that's awesome. Well, kudos to you for starters. One of the things that we would look at, and you're feel free to throw these details in here. So I'll be actually, Wendy, I'll be more generalized, but I'll make sure that my email's up here if you want to talk about it more meticulously. But one of the things that we would talk about is looking at your home strength training. What exactly does that consist of? Are you a resistance band? Are you free weights? How heavy are your loads? If your goal is to stay healthy and fit, and you're already there, that's really awesome. But we would talk about like current body composition, what your goals are post that. You can absolutely include dairy if your stomach is totally fine with it. There's nothing wrong with that. Trying to think of other things that you're already hitting. Make sure that you're still using, actually, since we just talked about it, you're having a good increase, or at least moderating your mineral intake, your electrolytes and what have you, because you look like you're doing a lot during the day. And we want to make sure that you stay optimal. We want potassium, magnesium, and sodium still circulating in your system. So we would look for something, electrolyte that's tasty to you, but one that you can, continually use. As far as that, looks like you're doing great. Yeah, honestly. And when I grow up, I want to be you, Wendy.
I was thinking the same thing.
Right?
Exactly now. Yeah. Well, she mentioned the carnivore lifestyle, and I would love to hear your thoughts on it. Like, what do you have any specific like opinions for or against a carnivore lifestyle? And then does it differ for men and women?
Yeah, in regards to carnivore, and um, it's funny. One of my coworkers and I were just talking about this, and people may come at me for this, but the carnivore is essentially like an adapted keto diet. I mean, I understand that there's a lot of protein involved, but you can still stay in ketosis and still do the carnivore diet. I've seen people jump back and forth between two. Actually, I think almost everybody, well, maybe not this current lab base, but since I've been here, everybody has like rotated through carnivore, keto, carnivore, keto. And as long as, again, you feel good, do it. If you're 65 and doing all of this, seriously, Wendy, I'm going to be you when I grow up. So really email me so we can talk about how you got to where you are. But no, you're absolutely fine staying on that. If that is how, if it feels good. And this is where we would talk about those resistance training too. We would talk about how heavy your loads are and what that feels like in comparison to rate of perceived exertion. So if you are lifting and you're like, I know that I've been able to lift more 5 years ago and I really feel fine at this, but I get tired after like the first X amount of reps, then we would talk about whether or not you need a little bit more calories. And your percentages are great, but we would also talk about how many calories you take in totality. Again, this would be useful with body composition and things like that as well. But yeah, no, you are absolutely fine on the carnivore diet. Carnivore diet, I don't have anything against that either.
Great. Thank you so much, Madison. You spoke a little bit about exercise, and you are also one of the lecturers on the Nutrition Network's Women Health Training. And it's really an incredible, insightful lecture. I watched it actually twice now, and I really enjoy it and taking notes for my own exercise regime. But I wanted to ask you, can you maybe chat a little bit about the different types of exercise? I think in the lecture you mentioned resistance training, plyometrics, agility, flexibility, aerobic training. I think that's the one. Yes, that's them, right?
Yeah,
Yes.
good
So
job.
can you maybe talk a little bit about the different types of training? Because like as a woman in particular, I mean, over the years, really, there's been so many different types of training that's been marketed to women, and this is the training you should do to get this body. But is there really like a specific type, single type that women should do, or how, like, if I want to start doing exercise, I haven't done it in a while, where do I start, and what's the different options to explore?
Yeah, I just want to tell everybody that this is what happens on low carb. Look at that memory over here. Doing great. No, so I'll end with resistance training because we've talked about that a lot. But I'll start with the others. So like plyometrics, I mean, this is really great. Plyometrics is great for having a decent amount of intensity in a very short amount of time. So those of you who have, young children that don't stop or don't sleep at all, this is really great. So having plyometrics, because the strength and shortening cycle and the loading of just the muscle to bone, it's super good for you. It can be hard to jump into. So if you are doing exercise for the first time, your plyometrics will probably not look the same as somebody who's been a little bit more advanced and been doing this for a while. Those are things like depth jumps, broad hops, squat jumps, essentially. We'll stay away from those if you are essentially novice to it, really, because we want to denounce form prior to, throwing you into really explosive power. But if you're looking for explosive power, these are absolutely applicable for you. Agility is great and dependent on when this novice person were to come in and do exercises with us. Agility is awesome because this helps with a decrease in risk factors. So we'll look for change of direction, things like that. So an older population, this would be really good for, because you never know if your grandchild's going to run after you with, a hockey puck and you got to move out of the way or something along the lines of. So we want that agility. We want that change of direction. It helps your body hyper focus on that. So even if the center of gravity changes for a hot second, you can kind of bring yourself back to neutral. Flexibility, we all know why this is useful. Getting too tight, honestly, I am a exercise scientist by trade, and I sit at a computer most of my day trying to write, work, and what have you. And so the flexibility is necessary because I'm basically sitting with my knees flexed, and where my hamstrings are extremely tight. So having that flexibility is absolutely great. Most of us have seated office jobs. Well, I don't want to say most. I am stereotyping here, but there are a lot of seated office jobs. And when you're not sitting at your office job, you're sitting and you're talking and speaking to your child. You're sitting and talking and working with somebody else. But there's a lot of tightened hamstrings and concerns there. So making sure that we have the flexibility, it's extremely applicable, and that you can jump into flexibility at any time. I know people that are working with their babies on flexibility. I have a friend who actually tries to, her son hyperextends and like pulls back, and she tries to get him to like let go and open up his shoulder blades and have that flexibility in there. So you can jump in at any time. Aerobic training, I mean, anybody can do that as well. You can do that at a lower intensity at any age, at any level. We look for aerobic training, or look towards aerobic training for cardiovascular concerns. So it helps with heart application and cardiac efficiency. Also, aerobic training, I'm just anecdotally and from the mental health aspect, you can stay in that longer doing the same thing over and over again. So whether you're running or elliptical or bike, and you kind of get in the zone and you get to talk to yourself a little bit. So I think that there is a dual effect in regards to aerobic training. If there are mental health concerns or somebody is jumping in this because they want to change their lifestyle, I would start them with aerobic training, and dependent on how they come to me would be what my duration or longevity of that aerobic training is. But it is a moment where you do, again, the same thing over and over again, whether it's running and you just keep going by yourself, but nobody's really talking to you, and you get a moment to kind of self-reflect, and you feel really, really great after. And then obviously resistance training. Everybody can start resistance training, whether it's body weight, whether you use barbells, whether you use exercise bands. Body weight and exercise bands are really great for the house if you really can't get to a gym. Actually, for somebody who's an exercise scientist, it's really hard for me to get to the gym. So we have a bunch of bands and random things around the house that we can utilize at whim, because you may not get that allotted 30 to an hour in order to exercise, but you can do resistance training that way. I'm definitely a pro put a weight in your hand if possible, just because there's so much benefit to working essentially against gravity to pick things up and put them back down again. Your muscles are into it. Your bone, obviously, we talked about this last time. You put more pressure on your bone, and it's going to help increase bone mineral density. And in regards to women, we really want to keep that bone mineral density as high as possible. I mean, there are just so many effects where so many benefits to resistance training. So all of those, depending on if you're novice or not, you should be able to utilize most of them. Again, aside from the plyometrics. Plyometrics, if we were to do a squat jump and you're very novice, we would just do a faster body weight squat essentially, and probably work you up to that plyometrics. But other than that, focus on form. Definitely form. So if you're jumping into exercise and there's some people that are like, I'm going to try squats for the first time, and their knees are over their toes and they're really actually just hurting themselves, that's not great. So if you're not sure if you're doing the exercise correctly, one, there's 1,000,004 forums, but talk to somebody, talk to a personal trainer or somebody who has been exercising to kind of work on form with you. But again, you can find most of this information online.
Thank you so much. I just quickly want to read you Wendy's reply to your feedback, saying, too funny that you ladies want to be like me when you grow up. Lol. Thank you for your comments, Madison. Okay, and then she just asked the email address, but I see our media team did put it there for her with all your information already.
Absolutely.
So I have a question. Like, is there like a perfect amount of exercise we should do in a day? And I know, and there's a difference between perfect or the ideal versus the reality. Because, like you said now, and I think it's the reality for a lot of us, so we do have a desk job, or, we have kids, and there's so much going on, trying to find the time every day, even to exercise, not always the reality. But I'm just curious, is there like a perfect amount of exercise or like an ideal amount of exercise for women and men?
Man, no. I mean, you have the CDC guidelines, which they have like 3 days a week of resistance training, and they want like everything separated between lower body parts, upper body parts, or push pull or what have you. And you can find again those online. And then you have ACSM regulations or guidelines, American College of Sports Medicine, and that's usually who we affiliate through, or NSCA. We do that as well. But yeah, and you have those guidelines, and those are great ones to look at to kind of guide your time essentially. But as far as perfect, no, this is individualized too. And it may be that you work out really hard, like, you get great workouts in 45 minutes a day for 5 days a week, 1 week. And then the next week, you're not doing anything at all. But your body feels really great when you jump back into it. Great. You were recovering for a little bit, and now there's muscle memory there, and your body's ready to go again. You'll know when you haven't exercised in a while or you don't feel great. You just do, especially after you get into a habit or create this habit, even if that habit is 1 day a week. Let's say that you want to start that out and you want to start with that habit, creating a 1 day a week. Awesome. You go to the gym or you do your workouts at home every Monday for 30 minutes. And then 8 weeks later, you skip a Monday. You know that you skip a Monday. You feel when your body is like, hey, are we going to go, jump on that mat? Like, what's going on? You'll notice. And so this is where it's really nice to have the guidelines that we do. It really is. But you are your own machine. You are your own individual, and men and women are completely different too. I mean, again, in a historical sense, men were the hunters and essentially we were the caretakers and what have you. But like, it's not that we can't do all of the things that they do. But if they want to work out 6 times a week and they're getting it done, that's absolutely fine. If you only want to work out 3 times a week, you don't have to compare yourself to that. And actually, comparisons to anybody else is inapplicable. That person is not you and will never be you. So you can create what works and what fits for you. If you know that your workout regimen isn't necessarily getting you to where you want to be, cool. That's where you can pull somebody in, maybe follow some of these guidelines, maybe increase your workouts an extra 10 minutes or what have you, but you'll know. And honestly, everybody that is probably on this live right now has felt that before, where they're like, I remember when I, did a really poor workout. It was only 20 minutes. And I was like, okay, that did feel great. But I also remember that one time where I only did 20 minutes of stretching and it felt really, really good. That's completely awesome. It is up to you. You can have people help you manage that thought process and kind of organize that workout for you. That's where personal trainers are really great and kind of come in. And then if you are more extrinsically motivated and you need to have that dedicated time or that dedicated rule book, then you can use things like the CDC guidelines. You can use publications. I mean, there's so many out there that have said, like, this specific bracket of population worked out for this many weeks, this many times a row, and had this many resistance training exercises. You can use those if you want, if that's what you need. If you're more intrinsically motivated, you'll be able to tell yourself whether you need to work out more or not. So all that to say, no, there's no perfect timing for you. And again, and it may change. Jumping on the women's train here, our workouts should change essentially with our cycle phases. We're just kind of, I don't know, towing at the surface on that, but we may feel some weeks we can work out and kick down doors, and the next week we can maybe walk to the fridge, get some water and our electrolytes, and go sit back down. It's just dependent. And so yeah, just it's unique to you. You can always ask for help, but you'll know what's best for you.
Thank you so much for that, Madison. Oka, I'm hoping I'm saying your name correctly. Saying, glad you mentioned resistance training. Many women in post-menopause stage are resistant to this activity, but it is really very effective, an effective intervention.
It really is. Well played. Well played. But yeah, I think that they are resistant to that because of the energy expenditure and the metabolic dysfunction that happens after we stop our cycle. Like I said, I think our body just loses its mind on the inside. And they're like, well, what do we do now? And so don't necessarily have the energy to go and do this activity. Once they get started in it, you'll see them even drop off and then jump back in and drop off and then jump back in. That's usually because there's a dietary application that kind of needs more elucidated that isn't. But essentially, no, okay, you're absolutely right. Like that, there are a lot of women that get to that stage and they're like, I'm tired. I don't want to do this anymore. But again, I believe that it's because of this it's not even mentality, this internal like clock that's like, okay, well, I'm done making babies now. So I'm good and put my feet up. But yeah, so I know Dr. Sines is looking at menopause specifically in for ketogenic diets, and of course she's an incredible athlete or has been an incredible athlete as well. So she wants to look at the exercise component of that. But hopefully we'll have some answers for you, and maybe a publication in the future that tells that you can just send your resistant ladies to. I'm going to use that from now on.
Thanks, Madison.
Yeah.
So you mentioned again that kind of that cycle and like what happens after menopause. And is that similar to what happens when you experience premenstrual syndrome, PMS? That a lot of women say, oh, I feel I have all these cravings. I don't feel like exercising. I just feel like doing nothing. Is that similar to what happens during or after menopause?
Yeah, similar in a sense that your body is timed. So all of these hormones are peaking at different times of your cycle, and when you have certain peaks or certain hormones that are at their peak, your body is craving different things, and it might just be due to changes of energy expenditure. And actually, one of the next study that we're doing is looking. Unfortunately, for the women that are going to be in this study, it's a little bit of a I don't want to say a mess, but it's very taxing because we're having them come in for 4 months every week of their cycle, and then we'll plan it for their phases. So we need to get cycle tracking done so we know what part of their phase that they're in, and then we're looking at blood draws during those peak phases as well. And at the same time that we're doing those blood draws, we'll be looking at resting energy expenditure, so how many calories that they're burning at rest, but also activity and fatigability of the muscle. So we'll actually have them on a biodex and essentially see how much activity that they can create at that time. They're going to keep the main work or their same workout throughout, but there may be times where a certain hormone is affecting our ability to push through and have full essentially neuromuscular connection. And so all of these things come into play with energy, how you feel, what you want to eat, what you're craving. And none of that has been elucidated for us. And we don't have a map at all of this. So ideally in the next few years, we'll get at least a baseline roadmap, some blueprints before we get the full picture. But yes, so similar to the postmenopause, that cyclical effect, it is also metabolically influenced in a way, and that will change. So if you do feel like a crazy person before X, Y, and Z starts, then yeah, I get it. I totally understand, been there, and you're not alone.
Thank you. And I mean, that is much needed research. So I'm so excited to hear that someone is now actually going to do it.
Yeah, we're very excited about this.
And grateful to the participants of the study, because that is I mean, participating in a study like that, it's a lot of commitment.
Oh yeah, it's extremely taxing and there's a lot going on. That's why we have them consent. Are you sure you want to do this? Are you sure? But no, we have some very interested participants. Some of them are, well, we're on a college campus, so you're finding girls who really want to know a lot more about themselves. I think we were talking about this last week, where we really didn't find out much about ourselves until either, trying to conceive or later on in life or something along the lines of. These girls are kind of having a jump start and they really want to know about themselves, which is awesome. So we'll do a DEXA, we'll do an in-body, which is a BIA analysis, and that's not as there's a more of a margin of error in BIA analysis than there is a DEXA, which is like the gold standard for body composition. But DEXA includes radiation, and I don't want to, continually add radiation to a person every week. So we'll look at some in-bodies. We'll look at body composition changes weekly. So we know that sometimes we hold a little bit more water in certain phases than others. And then we'll also look at the energy expenditure. We'll look at the activity and fatigability in the muscle. And then we also have surveys as well. So that'll be nice. Just having the surveys of the how women feel at different parts of their cycle. I know that's already out there anecdotally. Like, you'll feel a little bit more tired before your menstrual cycle starts and what have you, and you feel a little better after your menses is over, and you feel ready to take on the world. Obviously, the evidence is out there, but this will be another backing of that. So we're all in this together, hopefully.
That's amazing. I want to touch on PCOS a little bit. And can you maybe talk about the role of diet, lifestyle, exercise in PCOS, that maybe the development of it or the reversal of it, kind of the mechanisms around that?
Yeah. So back to that previous study, I believe, well, these women that came into the study they were overweight or obese, otherwise metabolically functioning. So they didn't have metabolic syndrome, which takes basically 3 of the risk factors. So they were just overweight. Otherwise, they were relatively healthy. But when women in this, and I don't know if this is globally, but I know especially here in America, women will go in, and depending on whether their doctor looks at the Rotterdam criteria or the NIH criteria for PCOS, women are diagnosed with PCOS dependent on whether they fall into these categories. If it's Rotterdam criteria, which was previous to the NIH criteria, there is less of the bullet points that they have to hit before they are coined with or diagnosed essentially with PCOS. But the issue with that is in regards to the Rotterdam criteria, it's just an umbrella term essentially. So you could walk in and just say, well, I've been trying to conceive and it's not really working. And they realize that maybe you're a little overweight, and you're young essentially. And that's prior to that geriatric pregnancy. And they're like, well, maybe you have PCOS. And then they send you along, they either put you on birth control or they tell you to lose weight. Not useful at all. So in regards to that study that we did, those women were healthy, but they lost weight and some of them regained their period. secondary amenorrhea, or loss of period in general, is obviously an issue or concern or a symptom of PCOS. And so this kind of drove the thought process on utilizing the ketogenic diet for PCOS. Now, we're not the first ones to do it, but there are different studies out there that have looked at certain parts of PCOS, because again, it's an umbrella term, doesn't really encompass all of the factors of it. So there are people who have looked at whether or not somebody gained their menstrual cycle back, whether or not the metabolic risk factors of PCOS, so like insulin resistance, has decreased from being on a ketogenic diet. I think Paoli did that one. There's been a few things that women who felt better on a ketogenic diet with PCOS, but we specifically want to target, since we saw the change in menstrual cycles in 6 weeks. This study will be 8 weeks. Well, the pilot will be 8 weeks long. The next phase of this, which is already in motion, is a 6-month study. And essentially that will be looking at not just that they get their menstrual cycle back, because that's great, but that doesn't actually confirm ovulation. You may get a period every month, but you don't know if you're actually ovulating. So the second phase of the study will actually be looking at ovulation. So we'll be checking progesterone and what have you afterwards. But the symptomologies of PCOS, especially on the metabolic side, are very similar to type 2 diabetes. And looking at the risks of women in PCOS, they're pertinent with risks for cardiovascular disease, cancer, ovarian cancer, all of depression, anxiety. These are all things that we have targeted with ketosis and a ketogenic diet. So essentially, if they are already at a higher risk for these other maladies, why wouldn't we utilize the ketogenic diet for this? And in PCOS, like I said, going back to that, either here's your birth control or here is your weight loss. I'm going to ignore, and not on purpose, but IVF and IUI here for a second, but just those women who aren't quite, it's so sad because they're not bad enough to say, here, yeah, you need further help in fertility, but they aren't healthy enough to have regular conception or like regular periods. And so they are put in this like purgatory almost of health advice. Like, it's not really helpful for them at all. So this study and utilizing a ketogenic diet, again, it's something that you can take control over. It's something that where you have no answers, you can utilize dietary intervention strategies and exercise strategies to ameliorate some of these symptoms of PCOS. And that's kind of how this started. Basically, we're attempting to forge the swords for these women that don't have a fighting chance. When it comes to IUI and IVF, that should be something that we check out in the future as well. But that's where you have basically gone to the doctor so many times that they're like, okay, I guess we'll do something else. But it really does take forever for a physician to work with a woman who has PCOS. So in our study, or in our proposal, we had talked to women in the community that had PCOS and asked, what are your experiences? What have you seen? Like, what works best for you, or what do you want to see in the medical field, in the clinical field, in terms of PCOS? And unfortunately, there was just a resounding, there's nothing there. I've been turned away. I mean, the LGBT community, those are the women who are trying to conceive and have a female as a partner, and then have PCOS as well. They're really just kind of put on the back burner, absolutely. And they're like, I don't really know how to help you. Well, I guess try again. And that doesn't really help. That's not useful. Women who are young and have only been trying for a year, but maybe they want to try in this year because they're in a gap between college and their job essentially, and they want to stay home with the baby for the first year. Well, that's great. But if you're 29 and you're planning all of this, they're like, okay, well, we'll care about you when you're 31. And that doesn't help either. And these are all testimonies. These are all, we actually had letters from the community sent in with our proposal over this. And so they're looking for something that they can take control over. Even if they have gone to the doctor and the doctor has helped them, it's been, okay, well, here is your metformin. Here is your birth control. Here, go ahead and just decrease your calories. It's not really helpful at all. They don't give them a dietitian. They don't give them a behavioral scientist. They don't give them any information or any help in regards to that. They said, we'll check back, in a few months. Yeah, this study is so important to me, essentially. But I had a hard time trying to conceive, and I don't have PCOS. So but when I had a hard time, I went to these research forums, but they were research forums from the community. So these women who are saying like, this is what I found, this is what I use, this is what I'm trying. And there was trying everything from Mucinex times during your ovulation cycle, to, seed cycling and what have you. All of these things, I learned more from women just trying anything they could to have a child than anything else. And there was a lot with PCOS, a lot of women with PCOS in the same boat, in the same circumstance where nobody was giving them any help and they had to take things into their own hands. So the hope with this is that, because of the similarities between type 2 diabetes and PCOS, it's on the metabolic side, the historic ability for ketones to essentially decrease inflammation status, which is another concern, I guess, pleiotropic effect of those with this umbrella category of PCOS. And then just the ability to kind of take control over themselves. I really, I know that we'll see great things in this study, not to go ahead and brush my shoulders off, but I know we're going to see it. I just think having this and maybe even the guidelines for women who have PCOS out there. This is how you take control, and nobody can tell you what to do. This is where you become your own heroine. So that's kind of what we're looking for here.
That's really incredible. And it's so true what you're saying. If you go to the doctor, they'll just offer you some type of medication or pill, often no true real explanation or providing you any understanding of your condition or why it is, or what you can do about it. Just like take the pill. And I think often what happens, and I've seen this also with type 2 diabetes and people within the community, kind of in this field we work in, people that end up getting better and even reversing certain conditions are often also those like those women that you mentioned that started doing their own research and started like exploring all the different options and seeing what can work, what cannot work, because they don't always get that information from the doctors. And I think that's also where a big problem lies, like that lack of, I don't know, like information, or it's just not, I don't know, it's
I think too is, now this is me on a pedestal here. I think we're such impressive beings, women. I'm not saying men aren't. I know incredible men, but I think we're internally such impressive beings. There's so much going on. The clockwork, just how our body just does things without us knowing. It's not like we sit there and like, okay, reproduce, like, it doesn't work like that, but our bodies just take over and do things. I think because of how intricate and complex we are, it's hard for them to answer a question without another question being asked. And I think because they don't have the information out there, it's kind of like, well, I really don't know what's going on, but maybe we should try this, and that's not really useful. So hopefully in the next few years we'll have a decent amount of those questions answered. But that's a cool part about being a female as well, is we're fine with answering a question and getting another question back, because that just gives us more to learn about ourselves. So I'm sorry, women, but we're coming. We're gonna make something. We're gonna make a change. Essentially, we're gonna have some information out there for us.
Yeah, hopefully the next generation and the next, they'll each have a little bit more information.
Absolutely.
Thanks to amazing people like you.
Like everybody, and Wendy.
Yes, and Wendy was actually saying now, just so let me know if you or know of anyone who would like a guinea pig for postmenopausal research regarding exercise and keto carnivore. So she's volunteering.
Oh, perfect. Seriously, Wendy, you're my girl.
So I don't know, do you maybe have 5 more minutes to chat
absolutely.
with us if you have? Because I wanted to ask if you can also speak a little bit about endometriosis, because I think so I've heard before, like PCOS, yes, you can reverse it to some extent, or you can better it, but is it the same for a condition like endometriosis, or how does that differ?
So that one is a little bit more of a heavier clinical population, of which if you were to work with a ketogenic diet, you would really need a dietitian on board, to be watching labs and things like that, just because of even the pain concerns of that. Now, ketogenic diets, ketones are known, obviously, we have the ability, or the ketones have the ability to inhibit inflammation. And there are some pathways and some studies out there that show a decrease in pain by being on a ketogenic diet, or potentially even using exogenous ketones. But dependent on whether pain level is intense, whether bleeding level is intense. And there are some people who have endometriosis, but I don't want to say mild, because it's never mild, but like the symptoms are less than those of others. You'd really want to work with a dietitian specifically to make sure that you're meeting all those things. And the excessive bleeding, you would want to make sure that you're pulling in enough nutrients and enough hydration. Something that maybe you want to pay attention to your minerals, your electrolytes, and water intake, no matter what. But in endometriosis, it's going to be a little bit more finite. And there's some testing that in labs that should be ran, that maybe in like women with PCOS who probably won't be able to cover that under their insurance, where endometriosis would be able to cover that under their insurance. So I do think that there is a positive, could be a positive play on ketones in regards to that, but that one would definitely, that would be a clinical trial that will require a lot of hands on deck, just to make sure that we're not harming more than helping. Just because that condition, oh, so sad. That one's painful, literally. I have a couple friends that unfortunately have to deal with that. And again, another moment in time where it's kind of like, we know that this isn't great. We know that this sucks, but we're going to attempt to mediate and modulate your symptoms this way. Other than that, we don't know what to do for you. So definitely more work needs done on that. And if there's a way that we can do this in regards to something that women can take control of, or so not necessarily pharmacological measures, but a dietary intervention, I think that strategy is absolutely needed.
Yes, exactly. I mean, and for me, like, it's like I hear more and more people around me developing that condition. And you know, and then it's like the question, like, is it just that people are becoming more aware of it, or is it that it is actually increasing? And so there's a lot of questions around it, and I think there's a lot of things that's not understood about it.
Right. Absolutely. And I think there's a lot has to play into the environment on why our reproductive health is changing. I mean, our ability to have a kid is now dwindling. And even if you can have a kid at this older age, you are still at a risk at a younger age than it used to be. And now we're seeing more incidences of endometriosis, more incidences of ovarian cancer, more incidents of all kinds of things. So yeah, I think environment has a lot to play in it too. And this it's potential that some of the birth control that is out there plays a key role in this. And girls are can be put on birth control pretty early. And a lot of those, they even like IUDs they put in, and they're like, okay, well, I think this is good for 5 years. And then it's in for 5 years. They're like, well, actually, it's good for 7 now, and what have you. And so technically, you're still a test subject, which I guess we need those, but it would be nice to have some confirmation on what those do long term, instead of like, this is the best, the most new device, go ahead and use this, or most new birth control, go ahead and use this. You can use it for X amount of years, but we have no idea what it does to you in the long run. So those are all concerns too. Definitely
Exactly.
things that need to be opened up and scrubbed out.
And then my last question to you, I promise, is
Right.
fasting and women's health. So, I mean, I've read a lot of, you know, like articles and opinions and things for fasting for women, and then
Mhm.
against it. And then I don't know if you know Dr. Mindy Peltz, she wrote a book called Fast Like a Girl, and she also got a book focused on menopause, which is very interesting. I read the one book, and I've actually tried to incorporate it, but like in different ways and different to what she prescribed. And I think it comes down to what you were saying, like not everything works the same for everyone. And I found just like a different way of what she's suggesting to use it. But I would love to hear your thoughts around it and the impact of that on hormones.
Yeah. So I would, by proxy, not on purpose, but I fast until about 5 o'clock at night. So I eat between 5 and 8, really, and then I don't eat again until I get home the next day. And essentially I find it that it's worked for me. There are other times that I'm hungry and then I break said fast, and that's fine. But again, this is individual for everybody. If you find that fasting works for you, that's absolutely fine. But it also is dependent on when you plan your workouts, what time essentially you get up, when you're going to have the most energy, whether you have an extremely stressful day or stressful job, you're going to have, there'll be more nutrients and more energy required for certain times than others. It's all very meticulous. And again, we don't even know in regards to our cycle when that works, when we're going to need more energy for that. So it may be that I'm really great at fasting, the week after my period, but I'm terrible at fasting the week before because, there is chocolate. So it's very dependent. I am all for, if it makes you feel good, absolutely do it. If you think that your workouts are good, and there's a difference between I feel like my body looks great. And when you're working out and you've been fasting and you get slightly lightheaded, but not too crazy, enough to push through, but that slightly lightheaded means that there's a little bit of a concern there and you need to figure out something, whether it's you need to increase your electrolytes at that time, or maybe you do need to eat a snack on something prior to your workout. I don't. And so I'll notice, I'll be like, it's my vision's kind of getting foggy on the outside. I'm like, I need to go and eat something. And dependent on your diet, if you are doing fasting, but you want to stick to keto, there are exogenous ketones as well that are applicable for you because essentially those are fats. So those are going to be calories as well too. So if you want to stay in that realm, you're more than welcome. There are some people that are able to like throw in some protein and tiny bit of carbs and stay in ketosis if that's what they want to do. But even ketosis is, even though we give you the guidelines, it's moderated to everybody else as well. So if you can stay in ketosis on X amount of carbs, we can absolutely do it. If you can stay in ketosis by throwing a little bit of carbs in, I think somebody had said that on the chat from last week, but they threw some carbs in right before their run or at the end of their run, I believe. Just a tiny bit, and they were able to stay in ketosis. You absolutely can do that. So yes to fasting if that's what you're into. If you don't, you want to eat throughout the day because it gives you something to do, or need something to do with your hands and your stomach, more than welcome to do that as well.
Great. Thank you so much, Madison, for joining us again this week. It's been an incredibly insightful conversation. I really appreciate it. We will probably invite you over again. It's just, I feel like it was clear by the response last week that, there's a need for these type of conversations. And there's a lot of women out there that got questions. And who better to ask, than someone that actually knows about this thing, and who is also a woman. So thank you so much.
That's nice, right?
Yes, exactly.
Not a problem. Thank you guys so much for having me.
Yeah. And thank you so much for our wonderful audience who joined us again this week. Really love having you all with us. We would love to see you again next week. Not the same time, but just keep an eye open on our social medias and you will see who we have in store for our chat next week. Thank you again, Madison, and have a lovely day.
Yes, thank you. I'll see you all soon. Have a wonderful day, guys.
Thank you. Bye.
Bye.